Okay, I'm ready.
Okay. You arrive to find a 76-year-old male sitting in the lobby, holding his hand to his chest and complaining of severe chest pain. A pink employee reports that the pain started right as he was talking with a loan officer. And the dispatch info is you are called to the local bank for a man with chest pain.
Okay. I would put on my PPE. Is my scene safe?
Yes.
Okay. Nature of illness, chest pain. You said it was a complaint of chest pain?
Yeah.
Okay.
Complaint of severe pain in his chest.
Severe pain in his chest. Okay, so possible cardiac event. I would go ahead and one patient, is that correct?
Correct.
Okay. I would go ahead and get ALS coming as well. At this time, I'm not going to consider C-spine. General impression of the patient is of an older male sitting in the tripod position. Chief complaint is chest pain. Is that how he says it? Chest pain?
Yes, chest pain.
Okay. And I'm going to check his level of responsiveness. Excuse me, sir. Sir, how you doing today? What's his responsiveness?
Responsive.
Okay. All right. I'm going to check his airway. Can you open your mouth for me, sir? Okay. Is his airway open and patent?
Yes.
Okay. How's his breathing rate? Is it rapid?
Normal rate, no work of breathing.
Okay. I'm going to go ahead and listen to his heart sounds, or to his, to his lung sounds.
So, lung sounds are clear and equal bilaterally.
Okay. And I'm going to get pulse ox on him and get an SpO2.
92%.
92%. Okay. All right. I'm going to go ahead and, because his O2 is at 92%, I'm going to go ahead and put him on a nasal cannula at 2 liters per minute.
Okay.
I'm going to, I'm looking at the patient. I don't note any major bleeding. I'm going to feel for his radial pulse.
Where you at? Pulse is 72 beats a minute.
Okay. And
I'm sorry, hang on, 75.
75. What's the is it strong, weak, normal? Does it clarify?
It does not say anything more on that.
Okay. All right. And what's his skin condition?
Skin is pink, warm, and diaphoretic.
Okay. All right. Again, because this is a possible cardiac event, I've got ALS coming, hopefully. I'm certainly going to make a priority transport of the patient, so I would likely at this time get him loaded up onto the ambulance. So I'd like to ask you some questions. I'm going to go ahead and move on to history. What was the how did this come on? What was the onset of these symptoms?
The onset was 15 minutes ago.
Okay. Is there anything that you think may have caused it, or anything that makes it feel better?
It does not say anything causing it, and nothing making it feel better.
Okay. And how would you rate the quality? How does that pain feel in your chest?
Stabbing.
Okay. And stabbing pain. Okay. How severe is that pain, sir?
8 on a scale of 1 to 10, 10 being the worst.
Okay. That's pretty bad. And when was it that this started? Just 15 minutes ago?
Yep, 15 minutes ago.
Okay. I forgot my little notebook. Are you allergic to any medications or anything else, sir?
Penicillin.
Okay. And are you on any current medications?
Lasix, Captopril, and Combivent inhaler.
What was that second one?
Captopril.
Okay. And the inhaler was what?
Combivent.
Combivent. Okay. All right. And what's your medical history, sir? Have any history?
Hypertension and emphysema.
Emphysema. Okay. All right. And when did you last eat or drink something?
Eggs, bacon, toast, and coffee 2 hours ago.
Okay. All right. And you had just come into the bank to talk with the loan officer, and that was what was happening before. Is that correct?
Yes.
All right. I'm going to, since he's not currently on nitro, that's not an option. I'm going to go ahead and take his vital signs. I'm going to get his pulse rate.
75.
Okay. His blood pressure.
168 over 94, and the patient states like he feels like he is going to die.
All right. We're doing everything we can for you, sir. Okay, I've got ALS on the way. Hopefully they're here soon. I would. Let's see. What's his respiratory rate?
20.
Okay. I would go ahead and consider aspirin for this patient. Up to 325. I think it's 320 milligrams. Chewable aspirin.
Okay.
No nitro. And I would go ahead and my field impression of the patient is that he is having a cardiac event, possible MI, but certainly angina, which hopefully the aspirin will help mitigate any clotting. I'm going to go ahead and reassess the patient every 5 minutes. So I would go ahead and take my second set of vitals.
Okay.
Since I've given him medication. What's my pulse rate?
Pulse rate is 72.
Okay. BP?
178 over 96.
Okay. And his respiratory rate?
20.
20 still. Okay. All right. I would then give a report to ALS. Hopefully they're here by this point. Either that or we are on the way to the hospital, and I'd give the report to the ER, whatever happens first. We have a 76-year-old male that was complaining of chest pain. Came on about 15 minutes prior to our arrival. He rates the pain an 8 out of 10. He is allergic to penicillin, but he is on Lasix, Captopril, and a Combreville inhaler. He has a history of hypertension and emphysema. He had eggs, bacon, and toast with coffee about 2 hours ago, and he was at the bank to talk with the loan officer when the events came on. His blood pressure was 75. His pulse rate was 75, blood pressure 168 over 94 with a respiratory rate of 20, and a SpO2 of 92 on room air. We gave him 2 liters per minute via nasal cannula and administered 320 milligrams of chewable aspirin. His second set of vitals, his pulse rate was 72, BP 178 over 96, with a respiratory rate of 20. All right, I've given the report.